Before we dive into today's episode, we want to give you a quick heads up. We will be discussing mental health challenges, including mentions of suicide. If this topic feels heavy for you, please take care of yourself and listen at your own pace, or feel free to skip this episode if needed. And remember, if you or someone you know is struggling, you're not alone. There's always support available. Hey there, tribe. Today I have Amy Mahler with me. She's the co owner of Mind Nourishment for the Soul. And we talked about the mission of making mental health help affordable and accessible. Her and her husband have actually developed an app called Mind Nourishment for the Soul that provides weekly transformational insights and challenges to help individuals really understand and change themselves. So the app is out in the stores right now. We're going to make sure to link it for you guys. But really, their mission is admirable. As therapists who work in the system for many years, they noticed there was a huge stigma with people seeking help, and also difficulties when it came to the financial aspects of taking care of mental health issues. So their solution was to coming up with the app. I'm so excited to have you guys listen to all the great ideas and strategies that Amy and her husband put together for you. Let's dive in. Welcome to the Accidental CEO podcast, where we bridge the gap between the creativity you love and the CEO mindset you need. I'm your host, Nada Salvatore, wedding photographer and business educator. Find full show notes and resources at accidentalceopod.com. Let's get into today's episode. Hello, everybody. Welcome back to the Accidental CEO podcast. I'm your host, Nada Salvatore. And today I have Amy Mahler with me. She is the co-owner of Mind Nourishment for the Soul, and she co-owns that with her husband. So we're going to talk about all the great things they have been doing to make things more affordable to all of us who need to work on our mental health, and all the great things that she has in store for Mind Nourishment for the Soul. So welcome, Amy.
Thank you. Glad to be here.
So just tell us a little bit about what the company is about, how did it came about, and then maybe we'll track back a little bit and talk about your journey to get there. But let's start with today.
My husband and I started My Nourishment for the Soul because we've worked in the field for a long time and we wanted to do something different and creative and kind of think outside the box, because we know that mental health continues to be on the rise. We know that there's still a stigma out there for a lot of people needing help, and it's still a struggle for a lot of people they're being vulnerable. And so we wanted to do something different and make it affordable and accessible for people to get help. And that's a big deal because, people are struggling with anxiety, depression, suicide, feelings of helplessness, family issues, you name it, cyberbullying, drug and alcohol, and just people struggling with life and wanting change and transformation. So we came up with Mind Nourishment for the Soul, which is weekly transformational insights to help you understand how you have become who you are and how to become who you want to be. And so we have created an app that you can sign up for, and you get these weekly insights, and you get a weekly challenge question that you self-reflect, and you get a journal, and then you also get blogs. And so we did this because we wanted it to be accessible and affordable, and it's $39.99 a year, which breaks down to 77 cents a week. And we wanted to break the stigma, because we know that when a lot of times people go to therapy, they have to go to their primary care physician, they have to get approval, and sometimes you only get 4 sessions or 6 sessions or whatever, and then you have to pay. So we wanted to do something different that can help people make life changes and do this through an app that's easily accessible. You can do it in the comforts of your home, when you want, wherever you want, however you want, at the park, at a coffee shop, on a work break, what have you. And we just wanted to make it really comfortable for people. When we combined therapy and education, and how we put it together was, when you challenge your thoughts, your emotions and your behaviors follow. And so it's really simple and easy for people to follow what we have set up for them.
That's great. I love that model and definitely want to dive into that a little bit more. But first, I want to know where were you doing before and how did that idea kind of came about? Like, was that both of you kind of seeing the same thing, or was it a patient that inspired that? Like, how did that happen to begin with?
We actually moved from Oregon to Arizona and we're just kind of enjoying a little retirement and just decided we were really done and just kind of came up with this idea knowing that mental health is still on the rise and just thought we need to do something different and creative. We've worked in the mental health field for a long time in the most restrictive environments in residential treatment all the way to least restrictive where people want to come to therapy for change. So kind of all over the gamut. We thought this was just kind of came up with it of this is a creative, innovative, outside the box idea to help people that are really struggling that is affordable and accessible. And also, you just read all the time that suicide's on the rise and people are afraid to admit that they need help. And this is a good way to help people on their own. You don't have to say, hey, I need help right now. You can just sign up and get going without all of the stigma that right now people are struggling with. So we just kind of came up with it and thought, let's just give it a try. You know, it can't hurt, it can only help. And it's for people that are just looking for personal change. You know, if you do it and you miss a week, you can go back to that week. You can work on yourself 3 times a week, you can do it once a week. And then you can go back and look at the progress that you made. If you see a therapist, you can see them once or twice a month. This you can work on every day. Like I said, 3 times a week, 4 times a week, once a week, and you can just gradually watch the progress that you're making throughout the year.
That's great. So you're both retired from from regular therapy right now?
At this point, we stopped, came here, moved here, and then we thought, let's get back into the field. So this is what we're doing. I also do on our website Amy at Solution Coaching. So I also do some coaching. So if somebody wants an individual coaching, we also offer that as well.
That's awesome. So let's dive a little bit more into just the business model of all of that. And what is that, that unique approach of integrating mental health and education? What kind of inspire you to adopt combining both of those and creating this model?
What adopted us is when you educate yourself, when you learn, you change and grow and develop. And with therapy, when you think about things, cognitive behavioral, you think about things, your behavior starts to follow and change and grow. You think, you change, and your emotions change, and your behaviors follow. And so, with your perception, when your perception of things results in, or your perception guides your thoughts and subsequently your emotions. And then all of that starts to follow. And so that's how we kind of combining both is that your perceptions, then it results into your sense of identity, and then subsequently your behaviors, and ultimately your sense of self. And so we are just kind of combining the whole learning process. And it takes time. Each transformational insight will, once you self reflect and become self aware and answer the challenge questions that pertain to your life and your life story and how you are wanting to change, you will start to see that change happen. But even if you were seeing a therapist and you're working on yourself individually, it would still take time. And so this is just working on yourself individually every week. You will start to see the change process happen. But we are challenging you to think about things, and then eventually your thoughts start to change and your emotions follow. Education, you still, when you think about things, you grow and learn and develop, and it will help you navigate the change as well.
Is there all self-driven in the app, or is there any interaction with a therapist or with the community in there?
If you want or you have questions, you can ask us questions and then we will respond back. But the transformational insights and the foundation is laid for each individual person right when you sign up. So everything, the groundwork is laid when you sign up for Mind Nourishment for the Soul. But if someone has a question, you can ask and they will respond right back to you. We do have a support your mental health group that you can sign up for. And then that also is something that we correspond with. And like I'll be starting to run groups. So that is interactional if people want to sign up for that.
How long was the process from the beginning of the idea to the app being done for you guys?
We're just launching. So that is probably the biggest hurdle is the app process, getting it exactly to how you want it to be. That's been difficult. Like I said, getting the goals and objectives that you want and how you want it to be, and then understanding this is how we want it, and it comes back and it's like, no, that's not how we want it. So that's that's probably been our biggest hurdle, and making sure it's exactly right, because you don't want to put something out there that's not correct and that's how we feel is right. And we're really passionate about this and passionate about helping people, and if it's not 100% how we like it, then we're not going to put it out there. So that's probably been the biggest frustration so far. We haven't had hurdles yet with someone signing up and having a problem. If we cross that bridge, we'll have to address it immediately. But so far, the hurdle's been developing the app and making it to how we like it.
Yep, as an app developer myself, I feel your pain. It is not an easy process, especially if you do wanna put the quality, product out there, and you will see once you launch and you start getting feedback and you're like, "Oh, I didn't think of this." Like, now you need to add this other thing to the app that's, takes longer and takes more out of your time and money, but it's all based on the feedback from the people that are using, which is great. Interesting process, but something, especially an app that deals with mental health and just health in general is probably something you 100% have to be very aware of the quality of what you're putting out there, because you're offering help to people that need and that would be maybe on the verge of, we're talking suicide awareness and things like that. And you can't offer a low quality product to these people. So we have to be very conscious of what is being put out there. So we appreciate you guys doing that.
Well, I was just going to say, you said exactly everything I was going to say is you have to be super careful when you're talking about people that are looking for change, so you can't put something out there that's not quality. This is for people too that are just looking for change, of, how they have become who they are, and people that want to learn how to become the person they want to be and are just wanting personal change. It's for people that are just needing a change in their life and are struggling and need to find out how they can get to be the person that they want to be.
Yeah, I'm sure it wasn't hard to really find validation for the market need for that kind of service.
No, they're definitely, and there's so many services that people can look for, but this is one that we thought is a good fit because it's not out there and it's affordable and it's accessible, and you can work on it, like I said, whenever you want. And it can't hurt people, it can only help people. And we're just in the field of wanting to help as many people as possible. And there's a need out there for sure. And with working people and their busy schedules, it's hard for a lot of people to go to therapy, even virtually. It takes time. And a lot of people just don't have time right now.
Yeah, that's great to be able to bring it to them at whatever time they can fit in. Definitely not available right now. So that's definitely a great idea, great concept. So as the co-owner, focused on development and just organization of the company in general, what's some of the strategies that you guys have employed to ensure that goals are going to be met and you're going to reach all the people that you're going to reach?
Well, we had two websites developed, the Become a Happier You, which is, and then Amy at Solution Coaching. And that was kind of how we started. And that's still making some changes there. And then the app was the big piece, the main focus, and the goals and objectives there to make sure that we could help whoever signs up to have all those things put into place. And then a marketer to help us market. That's not my field in terms of getting out there and marketing yourself. That's challenging. And so those pieces probably are the biggest pieces that we needed to put into place.
Those are great strategies and things that can be used in any entrepreneur business in general, like understanding what to delegate that is outside of your scope of practice and really having an idea of the big picture of where you need to be putting your effort and your budget towards. So that's great.
And right now we don't have other staff. It's just us. So,
I know how that feels.
yeah.
So I think you talked about it a little bit earlier, but who is the ideal client and how do you effectively communicate and engage them? without that stigma of traditional therapy methods? Have you guys been doing some more like personal outreach, or is all being done through the marketing? And who are the people that you're seeking for that service?
I mean, ideal client could be anybody seeking transformational and personal change. So we're not limited to somebody in their 20s. It can be young adults, teens, college students, anyone in their middle age. So it can really be anybody that's struggling and needing personal change. We're going to have marketers help us in terms of reaching out and getting to those people, in terms of trying to see who's out there that might need the help. But in terms of the stigma, I think you were asking about that, and the individualization. Once they sign up for the program, they immediately get the insights and stuff, and the transformational insights, and the foundation is set, and they immediately start. There's no stigma because they don't have to go through the insurance, and they don't have to do any of that. So that takes the pressure off of them. In terms of that, they just get started on the program. And the individualization piece is that everybody's story and life story is different. And so how they use the insights and the challenge question is based on their self reflection. And so that's where this change starts to happen. And so that's how it works, is the self reflection, and the change process will happen based on how the insights are set up and how the questions are given to them. So that's where it happens. My perception of my life story is different than yours, is different than someone else's. And so that's how it will all work once they sign up. Again, if they have a question, then all they have to do is write the question, write us a question, and then we'll respond right back, and they can get that in visualization.
Today's episode is sponsored by the Delegation Secrets How to Let Go and Scale Your Business course. Are you ready to scale your business without burnout? As an entrepreneur, you're juggling everything. Client work, marketing, admin, finances. It's exhausting. You build your business from the ground up, but it's time to ask yourself, how long can I keep doing it all on my own? What if you could free up time for higher level activities that truly make the needle move in your business? What if you could scale without sacrificing your sanity? It all starts with one word: delegation. The Delegation Secrets course comes with 6 different modules, and you learn everything from the mindset of delegation to identifying tasks you should delegate, build a trustworthy team, effective communication for seamless delegation, tools and processes for efficient outsourcing, and measuring success and scaling further. Let's break free together. You can find more information on accidentalceo.co/delegate-course. Now back to the episode. Just from my knowledge of just healthcare in general and mental health, it's such a vast field that we're talking about. We're talking about so many different things. So what kind of operational challenges have you guys faced in offering education tailored to an individual mental health need, given that the variation of, diagnosis and conditions and issues is so big?
With this so far, we haven't had the operational challenges so far, as well, we haven't had clients yet because we just launched. But putting it together was a challenge. And so that's probably been the biggest operational challenge, is trying to put it together, figuring out how we wanted to write the script for the transformational insights and the challenge questions that's going to help the therapeutic education piece, and help how the change process and how you rethink, challenging people to rethink their thoughts and all of that. So that's been the biggest piece in terms of the change process. So that's probably been the biggest challenge in terms of thinking about that. If somebody comes in is really, really, really struggling with mental health and suicide, since we're directly working one-on-one in terms of if someone's going to therapy and saying, I'm suicidal, we wouldn't know that unless they're actually talking to us and saying that. I would say you need to sign up for, like myself, Amy at Solution Coaching, or refer them, if someone is really not in a good place, because we wouldn't know that unless they were, immediately saying something to us when you talked about diagnosis, and if they were, had been diagnosed as something very serious. They're working on this program. So in terms of somebody with a really serious diagnosis, the operational piece and coming up with those or transformational insights, that's, a big piece because that's where all the change happens in the whole year. That's a big deal because that's where we want people to start seeing their change. And it comes from a lot of different things. It comes from, social groups, families, schools, belief systems, all these factors that help your thoughts and feelings help you to become the person that you are, and so we're trying to help you become the best version of yourself.
I'm sure you guys spent a lot of time together trying to come up with those tracks for everybody. So that's great. How has your own background as a therapist and your personal journey kind of influenced the strategic direction and the services that you guys offer with this business?
I've always known I wanted to be a therapist since I was in undergraduate school and then graduate school. And immediately after I got my master's in social work, just jumped right into working with young clients, young teens and adults and families in the most restrictive environment, which was tough because they're mandated for treatment. And then kind of, continued on all the way to less restrictive and just individual. So I've kind of worked in all different settings, but I've always had a passion since I was 18 working with people and in the mental health field. So I've known that, and my journey has just kind of continued on. And it's just kind of a crazy world that we're living in right now. And just seeing where we're at, just wanted to do something different and creative and try to help as many people as possible. And so that's kind of where it took us, wanting to see if we could help in a different way and try to help as many people as possible and make it, again, affordable and with no stigma. Because you do see and hear with suicide on the rise that people are not saying they need help, are keeping things inside. And then when people do hurt themselves or kill themselves or what have you, we're wondering what's going on. I didn't know. So this just gives people an opportunity that are hurting or that just want change to work on themselves in a different way.
So let's put our CEO hats on right now. How does your business model ensure that financial sustainability of the company while making services affordable for those in need? Because you kept the price of things fairly low. So have you guys looked into how you're going to sustain and maintain everything in the future?
Well, right now it's just all come from us. So hoping when we launch that it takes off. I mean, we've just started in terms, we just knew when we started it, we need to get a business going, the website's going, the app going, marketing, and we don't have staff that we're paying. And at this point, we're not, paying ourselves. So hopefully, when we get it, it's launching this week, it's out there, it will appeal to people and they will like it and they see that they're starting to make changes after the weeks are going by, then we can kind of look and see how it's going for us. I would love down the road if it is helping people to do something like this with the younger elementary age. This is such a big deal for younger kids. I think that would be great, but first things first. Got to make sure this is sustained and it works for us and it works for everybody. So we're just going to kind of wait and see because we just are in the beginning stages of launching it. But it's all been on us at this time. As you know, we're just kind of a two-man show.
That's great. But it's good that you're already having some plans to expand things in the future. If everything goes well, you have like a second market of clients that you're trying to help. So all of that is great, business strategy in general. So lessons learned as an accidental CEO, kind of reflecting on your transition from a therapist to CEO. What lessons do you feel like you've learned about leadership and entrepreneurship in the sector that you're in right now?
Well, in the mental health sector, it's big and you have to be creative and different and think outside the box in order to help people. There's always, you know, therapist and individual therapy, but in order to be creative and help people and want to be different and help people where they will want to go, want to make changes and be comfortable with this, I think, as an entrepreneur, you have to be different. You have to, be creative, and you have to make it comfortable for people and a safe space for people. That's a big deal. If people don't feel like they're in a safe space, they're not going to want to do something. So that's a big deal in therapy. The CEO hat as opposed to therapy, that's a big difference. As a therapist, I've always had my therapist hat on and worked with clients one-on-one and or families, and you knew exactly what you wanted to do and your goals and objectives, or what they wanted to work on. So that was just kind of your vision. This type of situation as CEO, there's many different hats you wear and auxiliary services that have to be provided. And if something doesn't work, kind of all doesn't work. That's a big challenge and a big difference for me, is that's you have to have it all working together or it doesn't work and it stops the whole process. And so that's that's been a big challenge as opposed to just working with clients and families. And that's probably been the most frustrating part.
Yeah, it's a hard transition for everybody. Usually we have this idea and we want to start this company or start this new business because we're really good at doing something, but we have no skills, no training around the actual business management of things and how to deal with all of that. So it's a struggle that we all go through in the beginning as we find ourselves in this position, but there's a lot of resources out there. That's why people like me, it's here to help people with business and mindset changes, and people like you do what you do to help them kind of be on the right place, because it is a transformation too. You have to go from this technician mentality to the CEO mentality, back and forth. You're really good at the skill, but now you have to manage a company and think about marketing and think about accounting and think about all kinds of things that you didn't have to think about before. So definitely a transformation, just like any other that we go through. And great resource to have your app out there too. So I'm excited for it.
I'm certainly well aware of things that I know I cannot do, that I have to reach out and ask for help, because that's just not my skill. That you have to say, "Hey, can you help us with this?" Because I don't know how to do that, or that's not where I studied and my, educational more expertise is. And so you have to, get someone else to help you with that, because this is where I know what I'm doing.
And that's not an easy thing to do in the beginning. You have that feeling that you have to do everything and you have to, keep everything under your wing because this is your new baby and this is your new idea and you want to be as protective as possible. But at the end of the day, if you're not reaching out and asking for help and delegating where you don't have the expertise, things are going to sink a lot faster. So
Exactly, exactly. And then you have to have a lot of patience.
exactly, yeah. So, what are the trends that you see kind of shaping the future of mental health and education? In are you guys thinking about positioning yourselves to be in the forefront of those changes?
Well, I definitely see mental health continuing to be an issue. I don't see that slowing down at any time. And I don't see like insurance companies ever slowing down either, in terms of wanting to limit the services for people. When people need services, they're not going to say you can have unlimited services for a year of seeing your therapist. I don't see that changing either for people. I would love to, like I mentioned earlier, be ahead of the game and maybe do networking with somebody, maybe do something for the younger age. Elementary school, it's getting younger and younger where people need help, so that's not changing either. So I would love to do something, like that. I think mental health is just going to continue to be life challenging for people. People are always going to need some kind of level of help, or always want some kind of, personal change, because there's struggles out there. It doesn't even have to be seriously mental health stuff. People just are always looking for some kind of help and a way to navigate themselves through life. And that's kind of what we do. So just to be on top of the game, always got to think outside the box and make it a safe space for people. I think that's a really big deal. People have a hard time being vulnerable. So if you can make it a good place for them to be, then that's half the battle.
Amy, where can people find you online if they want to work with you? And we'll definitely link the app whenever you have that ready to go. Make sure that people see it. But where can they find you if they want to reach out on online?
Amy at Solution Coaching if they'd like to reach out to me and support your mental health. My Nourishment for the Soul if they just want to check out on Instagram. And the app is on Apple and also Google. Go, you can start looking at that. So, and Become a Happier You can check out the website as well. So, if you want to sign up for it, it's on Apple. But My Nourishment for the Soul is, what the app is called. So, but love to hear from anybody. If they just like to message me on even Amy at Solution Coaching, you can do that as well.
Thank you so much for spending time with me and sharing these great news. This a genius idea. I'm sure it's going to help a lot of people out there, and I'm excited to see you guys grow.
Thank you so much for having me.
Absolutely. Thank you guys for being with us for another week, another episode of the Accidental CEO podcast, and we'll see you next week. Bye.
Thank you. Bye-bye.
And that's a wrap for today's episode of the Accidental CEO podcast. Thanks for hanging out with us in the world where creativity and business strategy collide. I am Nada Salvatore, thrilled to have shared this time with you. Remember, every episode is a step closer to mastering the art of being an accidental CEO. So don't miss out. Hit subscribe, drop us a sweet review, and spread the word to your creative tribe. Your next big breakthrough could be just one episode away. Join us next time for more insights, laughs, and actionable tips. Keep pushing boundaries, dreaming big, and embracing the beautiful chaos of entrepreneurship. Here's to make magic happen in your business and beyond.